The Eagle has landed. I am pleased to be able to tell Australians that shortly after midday, the first shipment of Pfizer vaccines arrived in Australia. They have touched down. They are currently being secured, and the advice that I have is that 142,000 doses have arrived in Australia. They will now be subject to security, quality assurance, in particular to ensure that temperature maintenance has been preserved throughout the course of the flight, to ensure the integrity of the doses and to ensure that there has been no damage. Further advice on that will be available in the coming days. Batch testing of some of the doses will be undertaken by the TGA, but subject to that, we will then, on the advice of Professor Murphy's Vaccines Advisory Committee, make sure that 62,000 doses are provisioned for second doses and for continuous dosing in the event that there was an issue in subsequent weeks, although we plan for, but we're not anticipating any such issues. But provisioning for that second set of doses is very, very important. It's something that not only the makers, but the TGA and very significantly Professor Murphy's committee have focused on. That means that we will be releasing, after all of these processes have been completed, approximately 80,000 doses for the first vaccines to commence in Australia on Monday, the 22nd of February. Approximately 60% of those doses will be allocated to the states. That will be 50,000 units, and that means that they will be able to begin with their priority for hotel quarantine. They will also be focusing on other border-related workers, those that are most likely to come into contact with positive international arrivals. That has been recognised by the states and territories, and we agree with this as the greatest risk of bringing the disease into the country. They will also be focusing on their residential care within elderly Australians that are within the state systems and the territory systems, and also on their frontline healthcare workers who've been such an amazing support to Australians. The Commonwealth will have approximately 30,000 doses which will be made available to aged care facilities. There will be a mix in the first week of rural and urban, every state, every territory. Further details will be made available later this week once we've confirmed the ability of individual facilities to be ready next week. That means that we are expecting that by the end of February, probably 60,000 of those doses will have been administered. We have to allow for the time taken to be administered for any issues that occur along the way. We have to be realistic. At some point, there will be a vial which is dropped. There will be other elements that will occur. We just want to put all of these into perspective, that the normal course of human activity will occur during the course of the vaccine rollout. But I have to say, the states and territories are magnificently prepared, and I want to thank all of them for their work. The aged care facilities are doing great work in preparation. The supply chain companies are all playing their part, and then of course the vaccine manufacturers are doing their work, as well as the TGA, the Health Department, the advisory committees. And I also particularly want to thank my office, which has worked unstintingly over the course of the last year.